What surprised me the most about Dr. Robert Floyd was his passion and his dedication to his patients. It was something that I hadn't experienced before until I started to work with him, and it was refreshing just seeing how available he was to me and being able to answer my questions and work with me as an individual in my goals and my treatment plan. My name is Rick Field, and I live in Fresno, California. I'm retired from the California Department of Corrections. I retired as a correctional administrator about 5 years ago. Before working with Dr. Robert Floyd, I had some medical conditions that I was trying to deal with. One of them was a kidney disease diagnosis that would run between stage 2, stage 3, sometimes stage 4 kidney disease, and my inflammation markers were pretty high as well. Generally, I run about 240 pounds, and I was looking to lose some weight, just become more fit and have a better lifestyle. What made me say yes to Dr. Robert Floyd was we had spoken several times, and I just really liked his approach to patient care and really did a deep dive into his program. I watched a lot of his videos, and there was really good information and some things that I knew that I could take advantage of going through the program, and that would help me immensely. If there's anything that prevented me from wanting to get started with the program, it was just my lack of time. Once I decided to go ahead and dedicate that time to that knowledge and watching the videos, it was very beneficial. He does a very good job with making the program easy to follow. Things I've tried in the past that didn't work for me are basically dieting, conventional medicine, and medication. So the best, most unexpected part of the program, I could say, was how much it helped improve my kidney function as well as lower my inflammation markers. It was the simple sugars, the processed foods, and just my diet in general. It wasn't until I went through Dr. Floyd's program that it became very clear to me how important diet really is. If it's too convenient, I probably shouldn't be eating it. In the end, it was just really amazed at how many medications, especially blood pressure medications, I was actually able to get off of. I wasn't taking Motrin nearly as much for the inflammation in my hands and my knees and my shoulders, and it was all because of the program and learning how to eat and just taking care of myself. What I'm able to do that I wasn't able to do before the program is exercise in different ways because of the amount of inflammation that I had in my joints. When the inflammation started to come down and when I started to get more movement back and less swelling, it allowed me to do things that I've wanted to do and that I did in my younger years. Do things like hiking and riding a bicycle and going a little bit heavier at the gym because I didn't have as much joint swelling and as much joint pain. I've recommended Dr. Floyd's program to many of my friends and family members and just people in general that I meet at the gym because it was so beneficial to me. It was life-changing. It really was. When I started to dedicate my time and my energy to eating right and understanding the program and being able to apply the principles of the program, it really was life-changing. And I hope that everybody, who watches this takes the opportunity to have a discussion with Dr. Floyd and listen to the benefits that I was able to gain off of the program.